Welcome back to movementprofessional.com. So I'm just going to demonstrate a couple uses of, this is a pinky ball that I just got off Amazon, but you can also use Joe Miller's yoga tune-up balls to work around a couple areas in the hips and the glutes. So the first area is going to be sort of like glute max, glute medius. We're just going to put the ball right here on the kind of side but top part of the buttock. And then the positioning is going to be kind of propped up, or you can be completely supine and open, and you're going to be somewhere between being in side lying and in supine. Okay, so the goal here is always to create deep pressure first, so you just want to be able to relax into it. So if this is too much pressure, you can just easily bring the knee up and take some of the pressure off. If you want a little bit more, you just drop the knee down. If you want a little bit more, you start bringing this leg over, and then propping up into a little bit of trunk flexion actually creates more pressure. So before we start adding any movement or rolling, we just want to be able to see how much pressure can be tolerated. From there, if we can feel pressure here, we can tolerate pressure here, we can create motion. This would be a little internal rotation, external rotation of the hip. All right, we can add maybe a lift and a kick. We can really explore just what creates some pressure, or what motions create more pressure around the ball. All right, so we can do that for about 2 minutes and explore there. But again, the goal is to really just increase your tolerance to pressure. So if it's a really sensitive area, don't be as aggressive. And it's not about more pain, it's just about over the course of weeks, if you can tolerate more pressure, that's a good sign your nervous system is responding well. All right, so the other area we're gonna look at is the side of the hip, the tensor fasciae lata area. So you got this bony part of the hip called your greater trochanter, and the bony part of the hip here called your ASIS, or anterior superior iliac spine. So in between there where my front pocket is where we're going to want to have this ball. So I'm going to then lie on my side, and again we're going to do the same thing. As I start to side lie, I'll create more pressure into the ball. So if this is as much pressure as you can tolerate, that's where you stay. Otherwise you're going to get all the way onto your side, stacking the knees. So the first thing you can do here is actually, again, just create pressure, feel heavy onto the ball. But the first movement would be to create some pelvic tilt motion. So if I go into a posterior tilt, I'll round my back and actually extend my hip. It opens the TFL area because that's a hip flexor. And then if I go into an anterior tilt where I arch my back, I'll actually contract the muscle. So I can go back and forth and give myself a little bit of feedback for these subtle pelvic motions. Then I can also create a sense of lifting the knee, which is a hip internal rotation moment, and then externally rotating by pushing the knee into the ground and maybe even lifting the foot, and explore the pressure around those movements. All right, for many people it's just about being able to tolerate this pressure and actually relaxing into the pressure, so exploring where you get some pressure and then just letting your body get heavy into it. All right, from there we can actually take the ball and put it down to the more lateral thigh and create the same type of work. So slowly allow the pressure to come on. So this might actually be a little bit more pressure. And a lot of times we'll talk about this as the iliotibial band. You're not going to really create a lot of change there because it's such a thick, thick fascia. But what you can think of is that it's sort of a septum between the quadricep in the front, the lateral part of the quadricep, and the lateral part of the hamstring and back. So you might want to explore a little bit anterior and a little bit posterior to see where the tenderness is, and then again you're just trying to get heavy into the pressure to allow your body to accept pressure and relax into it. And then we can add some knee extension, knee flexion. We can also create a little hip rotation back and forth once we get the depth of pressure where we want it. So about 2 minutes with all of these on each side, and the goal is over time to just be able to tolerate more pressure and be relaxed into the pressure. So I'm having a nice conversation here. I'm not gritting my teeth. I'm not holding my breath. That would be the goal with any of this, even if there is some tenderness where the ball is. If you have any questions, you can go to movementprofessional.com. I'll see you next time.